let's start by understanding the goals of treatment. What are the goals of advanced stage prostate cancer?
So in general, the goal of treating any cancer is to live a long, happy, healthy life with limited quality of life troubles from the cancer itself or its treatments. And so for localized prostate cancer, that generally means, treating with curative intent, that we give radiation or surgery, potentially in combination with hormonal treatments, so that the cancer is taken care of and people can be cured and not need further treatments moving forward at all. And there are situations, even in fairly advanced cases, where that's a reasonable and accomplishable goal. And there are other situations that we might not be able to cure the cancer completely, but the treatments can be quite effective at keeping it under control and keep people with a very good quality of life, so that prostate cancer is not a day-to-day burden for them, and that they can survive with cancer for years and years and years.
What do you typically consider when determining the best treatment approach or option for a patient?
So, the starting point and the ending point is the patient themselves. And so the patient means, what is their age? What is their fitness level? What are their activities? What's their overall life expectancy? What are their other medical issues? And then we consider the cancer, what is the stage? What is the grade? Where has it spread to, if it's spread? And then we try to incorporate all of those pieces with data, with clinical trials that have already been reported. And we have a lot of data in prostate cancer from patients who've participated in clinical trials, often randomized to one approach versus another, that gives us a sense of what are the approaches that really benefit patients in terms of increasing likelihood of cure or prolonging the survival. And so once we incorporate all of those things, we can come up with, some treatment suggestions, and then patient preference on those suggestions obviously plays a very important role. But sometimes we start down a line and, the patient is having troublesome side effects, or it's not working as well as we'd really hoped. And it's important to be adaptive and to change things if things are not going down a route that we'd really hoped. So, that's an ongoing conversation. It's not that you make a treatment plan at the first visit and that's the plan that's stuck with throughout the whole course of things. It's a conversation at every visit on how things are going in terms of how the patients are doing and how the cancer is responding. And then, again, try to manage side effects as well as we can and adjust things if we need to along the way, and maybe switch to something that's potentially going to be better tolerated or more effective depending on what we see.
Right. It sounds like there are many factors to weigh when making this decision.